Hey guys, my name's Sam and welcome to Prep Medic. In honor of Stop the Bleed Month, this week's video is a Stop the Bleed class from start to finish. So like I said, we are going through Stop the Bleed start to finish. And for those of you that don't know, Stop the Bleed is a campaign that's sponsored by the Department of Defense that's aimed at civilian preparedness for massive hemorrhage. We found that in shootings like Sandy Hook, there are a lot of preventable deaths that if we had somebody on scene right away that was able to control hemorrhage, outcomes would have been much better. So this course is put on by 4 main entities, and these are the entities that kind of gathered the data and put together the recommendations. These entities are the Hartford Consensus Group, the American College of Surgeons Committee on Trauma, the Committee on Tactical Combat Casualty Care, and the National Association of Emergency Medical Technicians. So I do have to warn you, some of the images in this class could be slightly disturbing to you. You know, there will be a couple images of gory injuries, but there's nothing too extreme as we move forward. The number one question I get when I teach this course is, why do I need this training? A lot of people misconceive Stop the Bleed as something that's tactical or something that's made for only shootings. That could not be farther from the truth. Basically, these committees found that the number one preventable cause of death in trauma is hemorrhage. And generally, an average ambulance response time in an urban setting in the US is about 8 minutes. In the rural setting, it's about 15 minutes, and that's give or take a couple seconds there. I'm ballparking some of those averages. But what that means to you is that somebody bleeding from a femoral artery wound has about 3 to 4 minutes before they bleed out entirely. And chances are you do not have EMS providers on scene yet. So it's really important that we have what's called immediate responders, and those are civilians trained in CPR and bleeding control that can potentially save a life. So where can you use this training? This training is good anywhere. It might be a school shooting or a workplace shooting, but more likely it's going to be a chainsaw accident or a car accident, something that is in your world normally. And most people at some point in their life are going to come across somebody that is severely injured. And if you have this training, you may be able to prevent a death. There are 2 main goals in this course, and they're pretty simple. Number 1 is to recognize life-threatening hemorrhage, and number 2 is know how to act on it. There are 3 skill sets we're going to talk about in this lecture, and those are pressure, packing, and tourniquets. All 3 are interventions to control potentially life-threatening bleeding. One of the first priorities when rendering emergency medical care to somebody is your own safety. If you get hurt, you can't help anybody else, and you're a drain on medical resources as they arrive on scene, because now they have to treat you as well as the patients that were already injured. So if you feel the scene is unsafe, stop what you're doing right there, see if you can move the patient to safety, and if you can't, get yourself to a safe location. In a shooting, make sure you're not doing care under active gunfire. In a motor vehicle accident, make sure you're not going to be hit by a car, and you can basically figure out what the risks are at any scene and just make sure you do not succumb to those. Along the same lines of making sure your scene is safe, you also have to make sure you're protecting yourself from potential pathogens. The main one with hemorrhage is obviously going to be bloodborne pathogens. If you have gloves or other types of PPE, I would always recommend you wear them. However, be aware that your skin, if it's intact, is actually a pretty good barrier against bloodborne pathogens. If you get blood on your skin, notify a healthcare provider. Make sure you're washing it with soap and water as soon as possible. And you might want to follow up with either the emergency department or your primary care provider to make sure that you are not exposed to any deadly diseases. Those of you that are healthcare providers and that have learned a basic assessment, you're going to know that the ABCs are usually airway, breathing, circulation. When we're talking just about hemorrhage control, your ABCs are going to be 3 main parts. There's going to be alert 911, bleeding, compress, and we'll talk about each of those in detail as we move forward. Calling 911 is your first priority because you need to get somebody coming to help you as soon as possible. It seems pretty self-explanatory, but a lot of times people will go to help and people will believe that somebody else is calling for help. So you have to make sure you're taking responsibility for that and getting an ambulance activated and getting them on the way to your scene, because it will take, like we said earlier, upwards of 8 minutes. So you need to make sure that they're on their way as soon as possible. It's really important that you know where you are, that you have an accurate location for your call. Dispatch oftentimes will have a general location, but it's sometimes hard for them to pinpoint you on a map. So make sure you have an address, a cross street if nothing else. And then always follow the instructions 911 operators are giving you. Many 911 operators are EMD trained, which is emergency medical dispatch, and they're actually trained to walk you through steps of bleeding control, CPR, and rescue breaths, along with some basic medication administrations. So they know what they're talking about and do what they say. The second step is bleeding. We have to recognize bleeding. So we have to find where they're bleeding from, and we need to look for 3 main things that are going to cue us into this being a life-threatening hemorrhage. One is continuous bleeding. Sometimes, especially like scalp wounds, you'll get there, it'll look really dramatic, but it's not actually bleeding anymore. So with those patients, we might not necessarily need to go to some of the extreme measures that we would if somebody has a life-threatening hemorrhage. You're also looking for a large volume bleeding. So this isn't, somebody bleeding just a little bit out of a cut. This is massive hemorrhage. And along with that comes blood pooling under the patient or around them. If you see that, that is a huge indicator this is a life-threatening hemorrhage. Be aware that the patient might be bleeding in multiple locations and you might have to intervene on multiple points. And then also understand that clothing can oftentimes hide blood loss. So especially a down coat, when I did ski patrol, one of the things they told us was a down jacket could hold 1 to 2 liters of blood before you saw anything externally. So make sure you're taking them out of bulky clothes and really pinpointing exactly where the blood is coming from. So you have 3 main sites you may be bleeding from. You have your extremities, which are your arms and legs. Now these are usually going to be treated with a tourniquet application above the injury. You have your junctional sites, so that's going to be your neck, armpits, and groin. And these are going to be treated with wound packing generally. And then finally, you have the injuries to your body. So that's everything in your abdomen, in your chest. And those are going to be treated by direct pressure, essentially, but there's not a whole lot we're going to do in the field for these patients. We're going to talk about each of these techniques as we move forward. All right, so the first technique we're going to learn is direct pressure. So to perform this, you're going to take a towel, a sweatshirt, a hand, and you're going to put it over the wound, and you're going to press down forcefully. You want to focus your pressure on the location of the bleeding, and then use just enough gauze or cloth to cover the injury. You don't want to be using huge amounts of clothing or a huge pressure bandage, because if you're doing that, you're not seeing if it's bleeding around that, and you can't really pinpoint where it's bleeding from. If pressure stops the bleeding, keep the pressure on the wound until help arrives. There's no need to go farther if this is actually stopping the bleeding. The next technique we're going to learn is packing. So packing is actually taking gauze or a shirt, towel, something, and it's pushing it down into the wound to the site of bleeding. This is primarily going to be used on your junctional injuries. Be aware that you can pack wounds on the arms as well, although a tourniquet is your best choice. If you don't have a tourniquet, you can move to packing for these life-threatening hemorrhages. The thought behind this is if you're just applying direct pressure over the deep wound, you still have bleeding inside of that, and you're not actually putting pressure on the artery, which is what is needed to stop that bleeding. So with wound packing, you're going to take gauze and you're going to just start pushing it into the wound to the site of bleeding. If you have a lot of pooled blood in that wound and you don't know where it's bleeding from, you can do a quick sweep with your finger and get some of that blood out, identify what artery is bleeding, take your gauze, you're going to put it up against that wound, and you're going to start packing the gauze into it as much as possible, fill it all the way up, and you're going to hold direct pressure over that until more help arrives. So what you want to use for wound packing is going to be hemostatic gauze if you have it. This is not powder that you dump into the wound. These are not recommended. Stick with the Committee for Tactical Combat Casualty Care's recommendations. So mainly that's going to be your combat gauze by QuikClot, or it's going to be your Celox gauze. So this is gauze that has a mineral on it. They have a couple different mechanisms of action, but it's generally a mineral that will help promote the clotting process along with that direct pressure. If you don't have that, just packing gauze will work okay. And then as a worst case scenario, you can always use a t-shirt, a towel, or some kind of fabric you have on you. Be aware that I have videos that go much more in-depth in wound packing and tourniquet application, so I'll leave those links down below in the description if you want to check those out and get a little bit more instruction on the skill itself. So like I said, generally wound packing is going to be used for your junctional sites where a tourniquet can't be applied. Although if you do not have a tourniquet, you can do wound packing on an extremity. The only thing to avoid is you don't want to be doing wound packing on the body itself, so in the chest or the abdomen. In the abdomen, there are some techniques for wound packing. However, you do not carry enough gauze to do that, and you're just opening it up for a lot of infection and potential internal injury. So we want to avoid doing that. And then in the lungs, you're going to start packing down, and you're going to be packing gauze into the thoracic cavity, which is going to do damage to the lungs and cause more problems than it's going to solve. Plus, you're not going to be putting pressure directly on the artery because it's probably deeper in the body. So avoid packing the body if at all possible. The last technique we're going to talk about is tourniquet application. Now, tourniquets are a constricting band that's placed above an injury that stops bleeding farther down that extremity. Tourniquets are a great tool, and there's a lot of misconceptions about them. You will not lose your limb just because a tourniquet's applied. This is old science, and they've really found that you can have a tourniquet applied for hours and hours before you have any neurologic damage to that extremity. So if you have life-threatening bleeding to one of your extremities, apply a tourniquet first line. You don't have to try pressure first. You can jump straight to that tourniquet to cut off blood flow. Generally speaking, a tourniquet's going to be placed 2 to 3 inches above the serious bleeding. You don't want to place it over the elbow or knee, and then you tighten the tourniquet until bleeding stops. Do not, under any circumstances, remove the tourniquet. That's something that a physician's going to have to do at the hospital once it's applied. Now, I will say that there are a lot of different brands out there. I will leave the link to the Committee for Tactical Combat Casualty Care's recommendations for tourniquets down below. I'd recommend picking up one of those. Don't go with some of these other commercial tourniquets that really haven't been studied. Once again, I've got a video that talks a lot more in depth about the recommended tourniquets, and you can kind of use that video to inform your purchasing choices for those. A couple things to remember with tourniquets. You can do self-application with them. There's nothing wrong with that. So if you're the one that's hurt, throw on a tourniquet, tighten that down, and get that bleeding stopped. Second, tourniquets are going to hurt. Explain that to the patient as you're doing it. It is not a comfortable experience because you're literally cutting off all blood flow to that extremity. And then understand that if the first tourniquet does not stop bleeding, you may have to apply a second one. If you don't have a second one, you can try tightening the one that's already on them. But once again, under no circumstances should you take the tourniquet off the patient. One concern that's brought up with a lot of people, and rightfully so, is small children. The CAT tourniquet will only fit down to a certain size. Most commercial tourniquets are the same, where they're not going to fit very, very small kids. There are a couple out there, but most are not approved by the Committee for Tactical Combat Casualty Care. Generally speaking, if they don't fit one of these commercial tourniquets, direct pressure is going to control the bleeding very well. And that's because kids have a much lower systolic blood pressure than adults, so it takes a lot less pressure to stop the bleeding. So a tight pressure bandage around their arm or just held direct pressure is going to be very effective for children, and they don't always need a tourniquet when adults do. Now, that being said, wound packing is going to work the same on children for your deep wounds as it will for adults, so don't be afraid to do that. All right, guys, a couple quick things to talk about. Number one, impaled objects. We want to keep those in place if at all possible. If we remove it, that object may have been up against an artery, and now you're actually causing more bleeding by taking it out. So keep it in and have a trauma surgeon remove that in the hospital. That being said, if that object's in the airway or interfering with compressions, you can remove it. Just be prepared to control massive hemorrhage from that wound. The next thing to talk about is improvised tourniquets. Generally speaking, they're very ineffective and probably should not be done if you have other means of bleeding control at your disposal. That means that we want to be packing these wounds before we're going to try to do an improvised tourniquet on an arm or a leg. They found in the Boston bombing, all the improvised tourniquets applied were ineffective when they got to the ER. That's not to say that this isn't something you can learn and practice and be effective with, but generally speaking, we want to avoid them. This might seem self-explanatory, but if the patient has lost an arm or a leg, you want to apply a tourniquet to that extremity regardless of the amount of blood that they've lost or if they're still bleeding. That's because they might be hypovolemic, so they have a lower blood volume, and they might be in a severe state of shock that's causing vasoconstriction that causes that extremity not to bleed. Now, as they progress down shock, that vasoconstriction will start to dilate and they'll start bleeding again. Also, once they're resuscitated in the ER with blood, then they're going to start bleeding as well. So we want to preemptively put a tourniquet on. There are also not too many downsides to doing this because you don't have to worry about neurologic injury considering they've already lost that extremity. Pain is obviously going to be a very real thing in these situations. One, their injury hurts. Two, you're either putting a tourniquet on them or you're packing a wound or you're holding extreme pressure on where they just got injured. Make sure you're communicating to your patient and doing your best to calm them down. If you're calm, they're going to be calm. All right, a quick summary of everything we talked about. So, number one, your personal safety is of the utmost importance. Two, make sure you got an ambulance coming to your location to get the patient to definitive care and take care over for you. You have to be able to find and identify life-threatening bleeding, and then you have to be able to intervene appropriately. So if the patient is bleeding on their extremities, generally speaking, that's going to be treated with a tourniquet. In the absence of a tourniquet, you can use wound packing and direct pressure to stop that bleeding. On a superficial wound, sometimes direct pressure is all you need. If they're bleeding from their core, so their chest or their abdomen, generally speaking, we're not going to be doing any intervention beyond some superficial pressure and getting them to a trauma center as fast as possible. The last step is just waiting for help to arrive. Don't get bored and let go of that pressure because they're going to start bleeding. It is your responsibility to keep the pressure on the wound for as long as you can until help arrives. All of this can be found on bleedingcontrol.org. I highly recommend you find a class that you can take in person and actually practice the tourniquet application. Whatever kind of commercial tourniquet you buy, you have to make sure that you are proficient in it. Like I said before, I would recommend going with a Committee for Tactical Combat Casualty Care recommended tourniquet. However, there are a ton of devices on the market, and make sure you're doing your research before you're buying one. Guys, if you have any questions, please leave them in the comments down below, and I will see you next week.